Hi, I'm Dr. Aviva Rodriguez, and I'm a senior consultant in fertility at Nova IVF. And I'm going to talk to you a little bit today about IUI and IVF and how the two treatments differ. IUI or intrauterine insemination, as against IVF or in vitro fertilization, have their own indications. Patients who are indicated for IUI are usually patients who do not have very long-standing infertility, who have fairly decent semen parameters, which may not be normal, but which are not abysmal either. Patients with anovulation or patients with conditions like polycystic ovaries where they do not form eggs on their own and need treatment or ovulation induction to form eggs. Patients with unexplained infertility where we really cannot pinpoint any reason as to why a couple is not conceiving. And an IUI usually serves as a first line of treatment for couples who come in with fertility issues. During an IUI, we give the woman medication to form eggs, and then when the egg is ready, we process a semen sample from her partner and inject that semen sample into the uterus. The success rates in an IUI are about 15 to 20% because we don't do very much more than just getting the woman to ovulate and processing a semen sample and putting it into the uterus. Still, a lot of things are left to chance as against an IVF, where in an IVF, the indications would be long-standing infertility, patients with low ovarian reserve, older patients who've already had treatment in the past, patients who've had failed IUIs. These are all indications for an IVF. An IVF is a much more advanced procedure where we actually grow eggs, remove the eggs into the lab, take a single sperm and inject it into each egg, make an embryo, and then transfer this embryo into the uterus of a woman. So as against just sperm, we are putting an embryo back here. So obviously success rates are far, far better. It could be anywhere between 40 to 80% depending on what the cause of the fertility was in an IVF. So what we really need to understand is after 2 or 3 IUIs, if it's not been successful, you need to move on to an IVF. There is no point in going on and on doing IUIs if they are not working. The recommendation for most fertility societies is about 2 to 3 cycles of IUI and then move on to an IVF. At Nova, we have the facilities to do both, and we do IVF only where it is indicated. IUI continues to still be the first line of treatment, and if an IUI should fail, then patients move on to an IVF.